Every 3 seconds, someone in the world suffers an osteoporotic fracture. Most of them had no idea they were at risk. Right now, your bones could be getting weaker, quietly, slowly, without you feeling a single symptom. Osteoporosis, the silent bone thief, and how to stop it. What if I told you that right now? Your bones could be getting weaker, quietly, slowly, without you feeling a single symptom. No pain, no warning, no obvious signs. Until one day, a simple fall leads to a life-changing fracture. That's why osteoporosis is called the silent disease. Worldwide, 1 in 3 women and 1 in 5 men over 50 will experience an osteoporotic fracture in their lifetime. And here's the most alarming part. Most people don't even know they're at risk. Today we're going to break down what osteoporosis really is, why it happens, who is at highest risk, and most importantly, how you can prevent it. Stay with me because what you learn today could protect your mobility and independence for decades. What is osteoporosis? Osteoporosis, OP, is a bone disorder characterized by reduced bone mineral density, BMD, deterioration of bone microarchitecture. In simple terms, your bones become weaker, more fragile, and more likely to break. It's diagnosed through a bone density test, most commonly using dual-energy X-ray absorptiometry, DEXA. Osteoporosis is a major global public health issue, especially common in women after menopause. But it doesn't happen overnight. Why does osteoporosis happen? Here's something most people don't realize. Your bones are alive. They are constantly being broken down and rebuilt through a process called bone remodeling. 2 main types of cells control this balance. Osteoclasts aerobreak down old bone. Osteoblasts aerobuild new bone. When everything is balanced, your bones stay strong. But when bone breakdown exceeds bone formation, bone density drops. This balance is regulated by complex cell signaling pathways, such as the Notch pathway, which control how cells grow, divide, and function. When these systems are disrupted, bone homeostasis is lost, and that's when osteoporosis begins. The role of estrogen. In women, the most significant risk factor is the drop in estrogen after menopause. Estrogen deficiency increases pro-inflammatory cytokines, promotes osteoclast differentiation, accelerates bone resorption. After menopause, bone loss progresses, especially in women over 65 who have low body weight, low body fat, low BMI, but hormones are only part of the story. Chronic inflammation, aging, and oxidative stress. Osteoporosis develops through a complex interaction of cellular senescence, microscopic cellular aging, oxidative stress, excess free radicals plus low antioxidants, chronic inflammation, hormonal imbalance, oxidative stress, and cellular aging, reduce osteoblast activity, less new bone formation, increase adipogenesis in bone marrow. Bone mesenchymal precursor cells differentiate into adipocytes instead of bone-forming cells. Chronic inflammation further stimulates osteoclast activity, impairs osteogenesis. The result? A progressive imbalance in bone remodeling, and the bone slowly weakens. Major risk factors you should know. Let's talk about real-world risk factors. You may be at higher risk if you have physical inactivity, older age female sex, previous falls or fractures, low body weight, a parent with hip fracture, long-term glucocorticoid use, cigarette smoking, excess alcohol consumption, certain chronic diseases, inflammatory bowel disease, rheumatoid arthritis, chronic liver or kidney disease, low bone mineral density. Smoking increases the risk of osteoporosis and osteopenia by interfering with calcium absorption, increasing free radical-related immune impairment, causing DNA damage, promoting inflammation, excess alcohol, high caffeine intake, vitamin D deficiency, and medications like diuretics and corticosteroids also contribute. Now here's the important question. Will you wait for the first fracture to find out you were at risk, or will you act before it happens? The good news: osteoporosis can be prevented and managed. Strong bones are built long before a fracture occurs. Treatment and prevention are possible, especially with lifestyle changes and proper nutrition. A Mediterranean-style diet rich in antioxidants can help improve muscle and bone mass. Helpful foods include low-fat, low-sodium dairy products, a variety of vegetables, fatty fish such as salmon and tuna eggs, nuts and seeds, vitamin C-rich fruits like oranges and strawberries. For fracture prevention, safety matters too. Install rails and grab bars in slippery areas, reduce fall risks at home, provide special care for high-risk individuals, because prevention is always easier than recovery. Your bones support you every single day. The question is, are you supporting them? Start today. Protect your future mobility. Protect your independence. Because once a fracture happens, rebuilding is much harder than preventing. The fracture is the consequence. The warning signs were years earlier. The question is, will you act now or wait for the fall?